is Jasmine Kabugatan, your student nurse from Davao Doctors College under BSN 11I. For today's video, I will be performing the return demonstration of skin, hair, and nails assessment. Prior to doing this procedure, we have to apply the hand washing technique to prevent the spreading of germs to you and to your patient. For the materials needed, we simply need a examination gown for the patient, a alcohol to minimize the bacteria and spreading of germs, gloves for protection upon inspecting the patient, and also a towel. Hello ma'am, good morning. My name is Jasmine Kabugatan, your student nurse for today. So, for verification, ma'am, can you kindly verify to me your full name, your birthday, and your age?
My name is Gian Kabugatan and I am 21 years old and my birthday is on July 22, 2000.
So, that is the first thing we need to do. We have to verify our patient's information in order for us to ensure that we have the correct patient in front of us. So, alright, Miss Jihan, how would you like me to call you?
You can call me Miss G.
Alright. So, is Miss Jihan is married or single?
I am single.
Alright. Alright. Remember that if there is any curtains or doors in your inside the room, then we have to close them to ensure the patient's privacy. And after that, you may now explain to the patients the procedure. Alright, Miss Jihan. For today's assessment, I'll be assessing your skin, your hair, and your nails. So why do we do this? We do this, of course, to ensure that everything is normal, and if there are any abnormalities on your skin like discoloration or skin lesion, we will take note of them, and to prevent also if there are any further complications. So, do you like the room temperature? Are you comfortable with it?
Yeah?
What language do you prefer me to use? Is it okay if I use English language?
It's okay.
Alright. So now, we advise the patient to remove their clothes and use this examination gown. So Miss J, I want you to wear this examination gown before we started the assessment. After that, we also have to cover the parts that is not necessarily to examine. Using this towel and cover these parts that is being exposed and not going to examine. So now, I will wear my gloves, and before that, I will perform my hand hygiene. Now, I already wear my gloves, and don't forget to remove your accessories like your watch. So now we can already start the assessment by inspecting the skin coloration of the patient. Okay, Miss Jihan, kindly raise your hand. So I will take note if there is any sign of cyanosis, pallor, or vitiligo, and erythema. So as I observe in your skin is color is fair and it is evenly distributed all through your body. Now, I will inspect the primary, secondary, and vascular skin lesions of the patient. So, ma'am, can I invite you to raise your hands? So, what are we trying to look here is to see if there is any signs of bruises, insect bites, or scratches. For us to know if there is any abnormalities on your skin. So, as I have observed, you only have skin lesions on your face, but any of your body parts don't have. But I will still take note of them. So now I will get the location and the distribution and configuration of your skin lesions in your face, so I can take note of them. Alright. After I inspect the skin, we will now proceed to the palpation. So the first thing we will do is to palpate your texture of your skin with the use of my polymer surface of three middle fingers, starting from your head, next to your arms, and down to your lower extremities, to your feet. So, Miss J, as I have observed, your skin is smooth and thin, except from the palms and soles of your feet that is normally thick. And while to your head and to your arms, it is smooth and rough, and yes. So next, I will palpate for the temperature and the moisture of the skin. So, but this time I will use my dorsal part of my hands because this is more sensitive to temperature. All right. So now I will put my hands over your face. Is that all right? All right. So as I assess your you have a normal temperature and there is no sign of fever. That indicates that you have a fever. So next, we will palpate for the mobility and the turgor of the skin. So I will expose the skin over the sternum and let me pinch your skin. Or is that all right, ma'am? So as I assess you have a good skin mobility, and it looks like your skin returns immediately to normal. That means there is no presence of skin turgor, and but it remains pinched. That means that you have a presence of skin turgor. That indicates that you have dehydrated. So for the second part of the assessment, we will now inspect the hair and scalp for general color and condition. So, alright, Miss J, when was the last time that you had your hair color?
I think 3 months ago or 2 months ago, in 2 weeks.
Alright, so I'm going to inspect your hair.
Okay.
Can I put this here?
Okay.
Move it. So, as I observed, Miss G, you had a healthy hair and it is thin and smooth. And I also noticed that your hair is starting to grow, and you also have a clean and dry scalp and no pattern of hair loss, and your hair is evenly distributed. No scars, no lesions, no excessive dryness or oiliness, and no parasites on your hair. The last part of this assessment would be the nail. So this time I will remove my gloves and discard it. Make sure to discard it to the trash can. So Miss J, can I touch your nails for me to inspect it? Okay, I observed that you had clean nails and groomed. You have a normal nail color and there's no white spot that you can't notice. And can you do this, Miss Ray?
Like this?
Yeah. No,
This?
yeah, like that.
Okay.
See, may I see? Yeah. Alright. So I observed that your nail shape is normal because it is at 160 degrees between the skin and the nail bed. So now I will palpate your capillary refill. May I see your nails? Alright, so upon doing this, we have to apply some pressure. Alright? Is that
Yeah.
okay?
It's okay.
Okay, so the color of the nails is quickly returns to its normal. So this means that you have a fast capillary refill. But if the color does not quickly returns to its normal, that means that you have a slow capillary refill. That indicates that you have a respiratory and cardiovascular disease. Okay, Miss G. I will just list down all the information that we have done. Alright?
Okay.
Okay, thank you, Miss J, for your cooperation. Before I end this, let me go back and review all the information that we have gathered. So, I'll just stick on what you have said. And you have been on headache for almost 3 days. And the pain is around 8 to 10, right?
Yeah.
And you have assumed that it is due to lack of sleep and your skipping of meals.
Yeah.
Alright, so for the skin and hair assessment and also the nails. So for your skin, you don't have any distinctive odor and your skin is fair. And you don't have experience any skin breakdown because your skin is good and intact. no lesions at all. You have a smooth and thin skin, and you have a normal temperature and moisture. You don't have any signs of edema or what. For your scalp and hair, your hair is in good condition, and the color is going into black, and your hair is evenly distributed and no pattern of hair loss, and you don't have any scars on your or lesions and excessive dryness or oiliness or parasites in your hair. And also for your nails, they are clean and groomed. You have a normal pink nails color and there's no white spot, and you also have a normal nail shape and it is smooth. So your nails and is attached to the bed, and you have a fast capillary refill. Did I miss anything, Miss J?
No.
Do you have any specific concern that you want me to give attention?
Not at all.
Now, well done. Thank you very much, Miss J. And I'll just go back to the nursing station and record this on my chart. And if you need anything, just I'll be just there, and wait for a moment because your assigned or attending physician will be here soon. So again, I am Miss Nurse Jasmine, and if you need anything, I will be just there. All right?
Okay.
Thank you.